Welcome to the Wellspring Counseling Podcast. We are very glad you're here. My name's Jonathan Kittle. I am a counselor here at Wellspring Counseling. We are a group private practice in Greenville, South Carolina, a team of counselors and therapists that exists to be a source for emotional and relationship improvement. And today I am joined by Margaret Kay, one of our great counselors here. Thanks for being here.
Yeah, thanks for having me.
Before we jump into talking about play therapy and specifically today, client-centered play therapy, I'm excited to do that. Tell us just a little bit about who you are and some of your background and how you wound up being a counselor.
Yeah. I've done a lot of my education and training working with children specifically. Did a lot of internships in Charleston at MUSC Children's Hospital and the D. Norton Low Country Children's Center for Abuse, which really, and just had a background of working with kids in high school and below, babysitting, swim coaching, all the things. So kids was something that I really enjoyed doing. After that, I went and got my first graduate degree at a really awesome school up in Manhattan called Bank Street College of Education. I had my degree in what's called Child Life, my master's. So that was a field in where I provided play therapy for children specifically in hospitals with medically related challenges. While up there, I helped start a play therapy center for the only burn unit in Manhattan.
Wow.
So that was a real big growth year for me and understanding how to provide that in a really extreme type of environment, therapeutic value to children who were going through like really painful healing processes, and all the other stuff that could come with burns, such as trauma or abuse and death. Then after that, did some work at Vanderbilt Children's in the cardiac unit, so dealt with babies and teens, all heart related, all sorts of procedures there. So with that came a really heavy load of grief work, supporting families with children who couldn't make it. And figuring out ways to provide therapeutic value for their time while they were there. I became a mom and kind of stopped working for a while and then decided I really wanted to get back, but didn't know, if I wanted to go straight back into the medical and the intensity that can bring. So went back to grad school and got another degree in school counseling and mental health from Clemson, and did a brief stint as a high school counselor doing college and career readiness with teens. Really enjoyed working with teens, and then found this lovely practice to start working at where I could do teens and play. So built a playroom here, and so now I do primarily private practice.
So awesome.
Yeah.
Thank you so much for sharing, because I don't think most of our parents and clients understand, like, even before you were like a licensed mental health provider, you had a wealth of experience doing play therapy with children.
Yes.
So I appreciate you kind of sharing that.
Yeah.
And excited to talk about this.
Me too.
So let's jump right in to talking about play therapy.
Okay.
It's certainly, it's one of the things that at our practice that we've become kind of known for, having you here especially. Not all group private practices have a play therapist. Yeah. Let's just jump into, like, what is play therapy? I mean, when someone asks that question, what comes up for you, and how do you think about how to respond? What is play therapy?
Yeah. I think a lot of people who do play therapy, and rightfully so, there's lots of different techniques and trainings on play therapy and how to go about that. So it kind of pertains to that one play therapist background. For me, and kind of what I do consistently in the playroom with children is from this one technique that I've been taught throughout my grad programs. Founded a very foundational piece of play therapy technique, and it's called child-centered play therapy, where it's a very non-directive, developmentally appropriate approach to children. And the biggest factor in that is the relationship between the therapist and the child.
Okay.
That is the healing crux of what we do is maintaining a safe therapeutic relationship where the child can have the space to heal and grow.
Yeah. So child-centered play therapy, CCPT.
CCPT. I say it all the time. Yes.
There's all sorts of acronyms in counseling world.
Right.
So child-centered play therapy, and the relationship between the client, the child, and the counselor is so crucial.
Yes.
Talk a little bit more about why that is.
Yeah.
Why would we not, maybe to think about it differently, why would we not just want to jump straight into teaching kids skills or telling them how to do something differently?
Yeah, I think that's a good question. So child-centered play is kind of guided by this basic belief and principle that, and I love this one. This is probably one of my favorite beliefs of the method, is that children have an intrinsic need and desire to grow and heal. And I mean, to me, that hits me in all sorts of different levels, spiritually, faith-based, the way God created people. Children have this innate ability to want to heal and grow. And yes, they do need adult supervision, and guidance at times, but also sometimes they need that space to figure it out themselves, especially the younger children who we want to parent and guide and supervise all the time. Their ability to heal and grow is primarily through play.
Yeah.
And that play is really providing a place where they can play out their experiences and form self-expression and work through hard things in play. Facilitating that environment for them to do that is really developmentally appropriate and really the only method for children, specifically ages 10 and under. It's giving them that space for those young ages is what
I like
is the beautiful theme and the belief of that method.
I love metaphors.
Yeah.
So is it similar to you get sick, you cut yourself, something happens in your body. Like a lot of times the body will heal itself.
Yes.
The healing happens naturally.
Yes, absolutely.
If certain conditions are met, or if I don't know, help me out there. Is that
white blood cells picking up when there's an infection or something like that? Our bodies were created to protect and heal and grow, right? And it's the same with children and their ability to heal and grow as individuals.
Yeah, it's a really cool way of thinking about it. It's like a wired-in mechanism. So you want to tap into that, and you want to use that and leverage that in therapy. You want to work with kind of how we're wired and created and designed.
Yes, and a lot of times parents come in and they talk about one problem, and so when children come in, and understandably so, but when children come in, I'm holding this belief that this child is not trying to have a problem behavior. And again, when I say child, I'm talking specifically about 10 and under. This child is frustrated.
Okay.
They're not able to meet an expectation, or something has happened to them that's really thrown their concept of self in the world off. And they're trying to understand and piece together and figure out how to accommodate that into their little life.
Well, again, a very interesting way to think about it. So you're saying a kid has a problem from the parent's view.
Sure.
But from your view, there's something underneath that. It's they're not just, I'm a parent. I know you're a parent.
Yes.
It's easy to see our kids and to think like, they're doing this on purpose. They know what they're doing. Why are they doing this? You're saying maybe they're frustrated on, would you say like a deeper level, or there's something kind of.
Yeah. I see all different types of situations, trauma, loss, grief, to just anxiety about new places. There is just this struggle to not be able to meet this new expectation or something set before them, which sometimes for the younger kids is what produces those, and really for all of us is what produces those behavioral problems.
Yeah. Yeah.
But, it's understanding that in the child, and also helping the parent understand that concept as well, to nourish that relationship between the parent and the child.
Yeah.
Ultimately.
Let's talk a little bit about play.
Yeah.
Because I know that's an intriguing concept.
Yes.
Sometimes there's a lot of confusion, like,
Yeah.
why playing, or how does
Sure.
that actually work?
Yeah. Play, I think, like I've said to you before, I think a lot of people, when I say what is play, everyone could have a million different answers and they could all kind of be right. For this podcast, play is elusive, but for this podcast, I want to talk about the idea of our structured and unstructured play.
Okay.
In child-centered play therapy, it really is purely what I call unstructured play of the child. Now, the environment is highly structured, but I am not being directive in the play. It is the child that is fully leading the play and the type of play that the child wants to do. So, we're not necessarily, these young children, we're not playing board games. We're not, doing these rule-based things. They're coming in and they're exploring and they're figuring out how to create play out of the materials in the playroom.
So you have a structured, like some boundaries, some environmental structures. You have to stay within these limits.
Yeah.
But within that, it sounds like there's lots of freedoms.
Yes.
Tell us some about, what makes it so important for the client to have that freedom to maybe go in a direction they want to go in?
Yeah. Kind of like what I said before, I believe children are intrinsically motivated to grow and heal. So it's really fascinating to let a child just play. There's been history, recordings of children in really, intense times. They are playing. I'll never forget hearing a professor talk about and showing a picture of children in the Nazi concentration camps. These Jewish children, and what they were doing. They weren't crying. They were playing. Who knows what they were about to experience, but they were playing. Some were playing comforting measures. Some were playing, mommy daddy measures. They were playing as a form of coping and self-expressing maybe what they need.
Wow. Wow.
Play is what children naturally go to. It is their children under age 10 is what they naturally go to form and accommodate and assimilate what's going on around them.
It's how they kind of make sense of things.
Yes.
Their language. Kind of
Play
thing.
is their language. You know what I'm talking about. Yes, that's a common thing. Play is their language. The toys are their words.
Okay. I've never heard that. That's
Yeah.
really cool. Play is their language. Toy is the words.
Or the symbols, right? Toys are the words or the symbols, and play is their language. So,
You said both expressing and coping. So it can...
A lot of things.
It can be, and more. Okay.
Yeah. Yeah. It can be expressing, whether the child is fully understanding what they're expressing or not. It's expressing, it's coping, it's processing, it's mastery, nurturing.
Mm-hmm. I would imagine as you're with clients again, and as you're giving them a lot of latitude, and a kind of freedom to begin to play, that you observe all sorts of things and see things come out. What are you? I'm just curious. What are you doing as a therapist in that moment? Are you just observing? Are you then taking what you see and then charting a course? What do you do? Because I know parents want to know what's happening.
Yeah, right. Again, non-directive is a highly structured environment, which means the toys are placed there for a specific reason. And I am constantly reflecting feelings, reflecting content, some of the skills that I use as a therapist. Yeah. Little interruption.
Sorry.
No, it was good. Some of the skills that I'm constantly working, there's 6 primary. It's reflective, which is one of the main skills I teach parents when they come in for the parent sessions is the concept of reflective listening and reflective of feeling. Yeah. So that takes me into the position of I am not trying to get my point across. I'm trying to understand the child.
You're trying to communicate that understanding
Yes.
by reflecting what
By
you
reflecting.
hear or see or
Right.
what
Yeah.
you notice.
The child that's anxious and comes into the playroom and has their back turned to me the whole time, and is playing one thing, I might reflect back, you're most comfortable right now playing by yourself. That's where you feel safe. You're not sure yet.
Yeah.
Reflecting kind of what I'm seeing in that play. That's a skill I'm constantly doing.
Can I
yeah.
zoom? I'm interrupting
Sure.
your 6, so forgive me, but I want to pull on that thread a little bit.
Yeah.
Because I also do a lot of reflective listening. I work more with adults. Why are we doing that? And more specifically, I want to know from your angle as a play therapist. So you want to reflect to a child. You seem really anxious.
Mm-hmm.
What's the hope? Like, what is that doing? What's that helping a kid be able to?
It's helping a kid, not feel like the adult is trying to judge or shame them in that moment. It's helping that child feel understood, and it's helping increase the bond of that relationship.
Okay. So it serves the relationship.
It serves the relationship.
It serves
yes.
them not feeling negative things,
right.
feeling seen. And
right. I'm not going to say you have to turn your back to me in therapy. I'm not,
right.
Making them come in and it's the parent's way.
Mm-hmm.
Therapists, one of the big things is we listen. So I watch children play and I reflect, and that's my listening.
Mm-hmm.
Yeah. To what the child is
doing. It makes sense. It makes a lot of sense. Okay. Sorry. I interrupted you. Tell me some of the other things you're doing maybe as you're.
Right. And, one of the second ones that parents really are like, okay, get to that. That's the meat. That's what I want to know is the limit setting.
Okay.
Because a lot of parents come in and are like, my child has these problem behaviors. And child-centered play therapy is actually, it is more permissive than in, going outside the therapy room because we want to give them that space. But there still are limits that are in place. Mm-hmm. Because we want to still protect and honor the relationship that's going on between me and the child. So,
right.
Children who have been bullied or abused or had some sort of, aggressive something happen to them, mm-hmm. a lot of times they come in and they will act things out, what they've experienced. That's their way of talking. That's their way of communicating. If play is their language, they're communicating, this has happened to me. Mm-hmm. And part of, my job is to allow a level of that permissiveness that probably wouldn't be allowed in outside of the therapy room. But there is a limit. You can't come and give me a black eye in therapy, right? You're really angry, so you decided to hurt me. No, we don't want to do that. So we learn how to set limits, and there's methods of how to set limits while still reflecting what the child is feeling or meaning.
Yeah.
So you're still relating to them, but for the sake of the relationship and
it wouldn't
their
be an
healing and
authentic
growth.
relationship if you were putting up with anything.
Yes.
But it sounds purposeful that they do have a lot of freedom to express, mm-hmm. more so than like just living their normal life at home.
That's right.
Okay.
That's right.
What else? Anything else you want to say about like what you're doing as a therapist? Because again, I think a lot of people are fascinated.
Yeah. So, reflecting, setting limits where they're appropriate and needed. I'm providing encouragement, as in the sense of, when children get frustrated of trying to figure something out and play, providing these words of encouragement and self-confidence, like, you worked really hard at that. You're proud of how this looked. You're smiling. You're proud of what you just created. Or it didn't turn out the way you wanted, but you really stuck it out and
mm-hmm.
you didn't give up.
Mm-hmm.
These things that still acknowledge, maybe some of the hardships of it, but also bring into the good, that encouragement piece. Other things that I do is provide choices, which is something I know a lot of parents have probably heard who are looking for parental, skills, is like give your child choices, but choices in the context of you have consequences for your choices too. For example, if a child chooses to paint mm-hmm. in the playroom, a child will wear a smock, and sometimes children don't like to wear the smock. Well, you choose to paint, you choose to wear the smock.
Yeah.
You don't choose to wear the smock, you don't choose to paint. It's your choice. You get to decide.
You decide, you get to make the choice, but you have to also own the consequences that come with the choice.
Right. Right.
And that is a great lesson.
And it's also still limits in there too. Like I'm still
Right.
providing limits and choices.
Right.
Let's see, what else am I doing in there? Returning responsibility, huge one. I get a lot of children who come in and what do I do? Well, in the playroom, you get to decide what to do.
Mm-hmm.
There's sometimes when children are just more prone to ask for help whenever there's a tense moment. And a lot of what I'm doing is returning that responsibility back. This is really hard for you, but this seems like something you can figure out by yourself.
That's really, really cool. And I think that's so
it's
important.
Empowering the children.
Right.
Yeah.
It's really nice to hear too, when we talk about the therapeutic relationship,
Sure.
Sorry for the jargon, people who are listening, but when we talk about it's the relationship between counselor and client that becomes, that has a lot of healing effect.
Yes.
One of the maybe confusing things, or I'm not so sure about things with that, is the client going to become too dependent on this therapeutic relationship? So it's really cool to hear that actually part of this very therapy is empowering them.
Yes.
To be responsible.
Yes.
Yeah, that's really, really neat. And again, I think parents will like that and will understand that.
Yeah.
So I'm interested to know what sorts of problems can be helped. I mean, obviously you're saying this model trusts that play is like the natural language of kids. So we're going to leverage that.
Yes.
It trusts that having a safe relationship where they can explore, where they don't feel judged, but it's within limits and it's going to hold them responsible. The relationship is also healing.
Yes.
But let's talk about, sometimes I kind of wish people would show up for therapy just because they want to talk or hang out. But,
Sure.
People come here because there's usually problems. There's
Yes.
usually challenges.
Mm-hmm.
What are the sorts of problems you see kids experiencing that kind of leads their parents to bring them here? And the problems that you see child-centered play being effective with?
Sure. I mean, problem behaviors in general, and those can stem from, parents aren't just signing their kids up for therapy just because they want to pay. But it is the problem behaviors, right? Something is they're not able to get their child to do what they feel like the child needs to be doing, or something has regressed or whatnot. But, it can range from anxiety, huge one that all of us see in counseling, and children can definitely have that as well.
Yeah.
Grief, loss, trauma.
Mm-hmm. Having gone through something really profound that's not impacting them still.
Yeah. I see a lot of kids with medical issues, past and present and potentially future, and trained in that child-centered medical play therapy has been really therapeutic for those kids.
Helping them kind of cope with and make sense of
what has gone on in their life. Yeah. Why something that could hurt could actually help them. It's hard. I mean, a child, it's hard for them to imagine that. The finality of grief. Children understand grief very differently than adults, and it's not fair to expect them to experience that, and it takes time. And also self-confidence. I mean, children walk away feeling self-confident, more competent of themselves, even young age children, because they had a place to explore, to struggle,
right,
within the confines of a safety relationship with an adult.
And because you're empowering them, and we're not just, doling out skills, like telling them directively what to do. They're the hero, kind of.
They are. And I think
really
a huge part, too, that I haven't talked about is in that aspect of healing a relationship is like there's 8 principles of guiding, and one of the biggest ones is unconditional positive regard for the child. So we're coming in, and no matter what they're bringing, we're accepting them for who they are, and we're creating a warmth. One of my biggest mentors ever said, a child has an innate ability to know if an adult is expressing joy in their presence.
Wow.
And that's always stuck with me, and something that I aim to do when children are in the room. It creates safety and value in that child's life.
An innate sense to know, am I getting this right, whether or not the the adult is
experiencing joy in their presence.
Experiencing joy in their presence. Wow.
Yeah, it's one that I chew on all the time with my own kids.
Right. It's an aspirational
Yeah.
goal. It's so, I mean, we're all busy.
Yeah.
And there's stress and, yeah, that's a great thing to try to aim for sure. Speaking of that,
Sure.
Let's talk a little bit about parents and what role do parents have in the therapy process?
Yeah.
Another common question that we hear all the time, like, so do I just send my kid there?
Yeah.
And do I hear, like, how do parents, what can they expect if their kid is kind of going through a child-centered play therapy process?
I think, first it's the parent consultation. We, like Wellspring values and definitely upholds the role of parents and children's lives, caretakers as the primary, and we're the support. So definitely having that parent consultation and really trying to help them understand as best as possible what child-centered play therapy is and isn't, and helping explain the things that are weird. Like, you just let my child play and all y'all do is just play. You don't have a goal in there. And I'm like, well, I do have a goal.
Right.
It's just not like we're going to accomplish this. It's I wait and observe what the child brings to me.
Right.
And
the goal is to use play.
yes,
right?
whatever the child brings, I have my tools and I go in there and I start using them.
Yeah, so
track and promote change.
You start all your counseling sessions with a parent-only meeting, trying to get to know them, to hear their version of what's happening. Right.
And then I typically explain to the parents 3, 4, 5-ish sessions with the child. I like to have a parent, session again where I kind of see the pulse of, hey, how's it been going lately with you and your child? And I say you and your child because I want to know about their relationship. If we're believing that the power in this therapy is the healing relationship, then obviously I want to empower parents to also have a healing aspect of relationship with their child.
That makes a ton of sense.
So I'm in those therapy sessions. I'm working on teaching, and baby steps of until they master one, teaching a skill. And, the first skill, like we talked about, is reflective listening.
Yeah. That's so cool to hear. Again, so we're not...
And how to do that when a child plays, right? It's kind of, and what it means, like, phone down, eyes on the child at their level. Like, it's not just... Oh, you seem frustrated. That block fell off your Lego. Come grab a French fry. It's not that. It's, it's being intentional in that moment.
Mm-hmm. Yeah. None of this stuff sounds super profound. Like, it's very simple, but it's not easy to live this stuff out.
No, it's not. We're busy.
Yeah.
And we've got a lot on our plates, and I feel that too as a parent. And I think, it's good to be reminded to slow down and what are we doing all this work for? I mean, hopefully some of that is for the relationship, for the child.
Right.
Yeah.
But
and healthy relationship.
Really neat to hear, like, so again, leveraging play, leveraging the relationship in the room between you, the counselor, and the client.
Yes.
But ultimately empowering and supporting healthier relationships between parents and kids.
Yes. And then, eventually, hopefully it moves to the parents sometimes coming in the room and observing me, but then also me observing them and supporting them in some of that skill and teaching ways to implement some of these techniques of establishing a safe and healing relationship at home.
Yeah.
Because that, like, okay, well, what if the child still doesn't listen? Well, the aspect of reflective listening and these things that establish a healing relationship is so that your child hears you better.
Right.
Because a child is going to hear you better if they know you love them.
Yeah.
And you experience joy in their presence.
Right. Relationships are always a two-way street.
They are. Yeah.
We can't just demand for the other person to maybe improve or change things and not tweak things and invest differently ourselves.
Right.
Again, not a crazy concept when we say it out loud,
No.
but hard to live out, kind of convicting sometimes if I'm honest about that.
Yeah.
So if you had the ear of parents kind of all over Greenville, where
Sure.
we're at,
Yeah.
what would you want them to know? Is there a takeaway message? Like, what would you want them to know about play therapy or supporting their kids. And I know we've talked offline. Like we in no way believe that counseling is the solution for every problem.
No.
And nor do we think that everyone needs to be in counseling long term.
Sure.
But what would you want parents to know?
Yeah, I mean, there is no guarantee that, all the problems that you're wanting fixed in your child is going to just be fixed fully and, I can just do my voodoo and like they're fixed. But I think what you do walk away is valuable tools of how to connect and relate to a child for the sake of that relationship. If the relationship with a child does matter to you, not just that the child can do what you want them to do, but that a child can say at some point in their life or feel that I have a safe connection with my parent, then this will absolutely teach you skills on how to accomplish that.
Yeah, that's well said. Well, I really appreciate you making time to talk. It's been fun to learn, fun to hear from you.
Yeah.
And thanks for listening in. We will put some links. So if you want to learn more about Margaret Kay and kind of read about her background, her bio, you can check those out. And again, hopefully you've enjoyed this and hopefully it's been beneficial.
Yeah.
Thanks again, Margaret Kay.